I've lived in chronic pain for over 13 years now. I've had disc replacement cervically, shoulder surgery, spinal fusion. I have fibromyalgia, degenerative disc disease, adult onset scoliosis, and Lyme's disease. So all of those working together, and I was in a serious car accident when I was 21. And that's sort of what really offset everything, is the discs that were affected after that wreck. Under 20 years later, I had to start having surgeries on. So my quality of life definitely changed. I'm 51, and if it weren't for doing things like juicing, trying to boost my immune system, really becoming aware of sustaining and maintaining your muscle health, thinking about regenerating our ligaments, bones, how do we keep our bones healthy, things like that. It's taken a long journey of educating myself, self-education. And then sometimes I have noticed when people arm themselves with information for the betterment of themselves, it's almost seen as something we are not supposed to do. Like, I've gone to doctors for Lyme's disease that I thought it was going to be like meeting God or Jesus, and I would walk out with this miracle answer. They were clueless and couldn't help me. So really just in really listening to your inner and your body, and forgetting all the naysayers around you that tell you, oh, you're fine. Or I get a lot of people say, you look great, you look so healthy. Well, that's wonderful. That's the outside. The inside can still be sort of ill and diseased. So when we become aware of those things and we follow through and become proactive for ourselves, that's one of the best medicines, is taking that step forward. And really at any age, people can have things, but we are sort of conditioned to stay within a realm of thinking for physical vessels and health and not question that. And I think it's very important going forward to really listen, educate yourself, and if you're not sure that you like the answer that you get in whatever medical, go for a second opinion, go for a third. Find the things that help you feel good and stick with them. Absolutely shocked. I was floored because my doctor, he could feel in certain trigger points, and he's like, oh gosh, you've got the fibromyalgia. And I sort of knew that, but hearing that, I'd heard it from another doctor, a rheumatologist, but hearing it from this doctor, it just really sunk in. And at the same time, because so many issues, you'll have deficiencies. I have fought anemia for about 13 plus years, and he started getting to the root of that, because at that point I almost had no iron. So it's been, and it's a journey where, and people need to realize this, you'll learn after you listen and you become proactive, and you can take these great, like, big astronaut steps on the moon and make great leaps forward, but sometimes the body and environment will push it back. So it's sometimes 3 steps forward and a few steps backwards, but you have to continue on all the things that you find that help your body. And everybody is different, so it's finding those things and sticking with them.